So, assalamu alaikum, everybody. Good afternoon, good morning, hello, good day, wherever you all are joining us from. I'm Dr. Sohaila Chima. I'm the Assistant Dean for the Institute for Population Health here at Weill Cornell Medicine, and also an Associate Professor of Clinical Population Health Sciences. So I want to extend a very warm welcome to all of you joining us from different parts of the world. So we are today doing the Health and You Community Wellness Series. As you all know, the overall goal of this series is really to create community awareness about health and disease. And our ultimate objective is really to enhance self-care, reduce suffering, improve the quality of life, and increase healthy longevity. So just some housekeeping, your cameras and microphones have been turned off. Please use the Q&A, the question answer feature, to type your questions or comments. You can also actually post them in the chat and we will be able to see your comments or questions. Questions will be addressed at the end of the session. And just a reminder that this is not a CME CPD activity and no certificates of attendance will be issued. So I also wanted to wish Ramadan Kareem to everybody. We are in the blessed month of Ramadan, and I hope for those of you who are fasting, the month is going well. And inshallah, it'll be over soon. We are already down to the 2-week mark. And we have a really exciting talk today, which we thought was very relevant to the month of fasting. So the topic is about fasting. And again, as you all may know, intermittent fasting is becoming an increasingly popular lifestyle intervention. And this session will really review the different forms of fasting, including Ramadan fasting, as well as the health benefits associated with fasting. So we have a wonderful expert speaker today, and I'm very, very honored and privileged today to introduce Dr. Tariq Chukir. He's an endocrinologist with a clinical interest in obesity and in preventive medicine. He is a graduate of Weill Cornell Medicine-Qatar. So very, very proud of Dr. Chukir. He received his MD in 2015, and that followed by a residency training in internal medicine at New York Presbyterian, Weill Cornell Medical Center in New York. He's also done a fellowship in endocrinology, diabetes, and metabolism at New York Presbyterian Hospital, Weill Cornell Medicine, Memorial Sloan Kettering Cancer Center, and Hospital for Special Surgery in New York. He is American board certified in internal medicine, endocrinology, obesity medicine, and clinical lipidology. So Dr. Chukir, very warm welcome to you. Thank you for doing this, and really, really excited, that you could join us for the session. Over to you.
Thank you so much, Dr. Chima, for the nice introduction. Thank you for the invitation. Let me share my screen. Perfect. Right. It's always my pleasure to give a talk on ways to optimize lifestyle. As Dr. Chima mentioned, my clinical focus is on obesity management. I'm really passionate about this topic, and we're going to discuss fasting today in details. I have no financial disclosure related to this talk. Intermittent fasting is growing in popularity. Over the last few years, there has been more than 150 books published on this topic. A lot of us have practiced it. A lot of us have talked about it to friends, family members. Let's try to figure out whether it really works, whether the evidence supports it, and whether it's the intervention that will fix our obesity epidemic. Because a lot of us do intermittent fasting for weight management purposes, I will start by giving an overview of obesity. I will go over the definition and the different forms of intermittent fasting. I will discuss the impact of fasting on weight loss, the impact of fasting on cardiovascular outcomes. I will also discuss ways to optimize fasting, how to benefit the most when you fast. Obesity is highly prevalent worldwide, both in the US and in Qatar. You can see the prevalence of obesity in the US is is increasing, and we're clearly failing to reverse the trend. The prevalence of overweight among Qataris in Qatar is more than 70%, and the prevalence of obesity is more than 40%. These numbers are really high, and they're associated with significant comorbidities and other diseases. When I talk about weight management with my patients, my family members, my friends, I tell them that we're not fighting obesity for cosmetic reasons. We're fighting obesity because obesity is a disease. It's associated with a significantly higher risks of several diseases and several cancers. This table compares people with normal BMI to people with higher BMI. And here we can see that people who have excess weight are at increased risk of heart disease, stroke, diabetes, kidney disease, liver disease. They're at increased risk of some cancers like lung cancer, breast cancer. Our perception and approach to obesity has changed over the years. In the past, we thought about obesity as a disorder which is blamed upon the patient. Now we treat obesity as a biological disease. We know that there are several factors contributing to obesity. There are some genes that have been identified. There are some hormones that work really hard to prevent people from losing weight. This is an interesting study that I wanted to share with everyone. Here, what they did, they included patients who have normal weight and patients who have excess weight. And they gave both groups sugar. They had them drink glucose. After they had glucose, they did an MRI and they looked at the areas of the brain that are activated in response to the sugary drink. Here you see that the areas that are activated are different in people who are lean compared to people who have obesity, which tells us that the way we process things are differently. For example, people who do not have excess weight, after drinking glucose, the area of the brain that gets activated is the frontal area, which is the area involved in decision-making, cognitive thinking, which is part of the reason why it's easier for people with normal weight to control what they're eating, what they're drinking, compared to patients with excess weight. Here we see that people with excess weight, after drinking glucose, the areas that get activated are the reward motivation regions. That's why it's harder for them to control what they eat, which explains why obesity is a disease and it has to be managed as a disease. So when we manage obesity, we use different interventions, including lifestyle modifications, plus or minus medications, plus or minus bariatric procedures. The mainstay is lifestyle modification. And the key thing about lifestyle modification is calorie restriction, the dietary intervention. Calorie restriction can be done through continuous calorie restriction, which is the conventional dieting that everyone knows about. Or calorie restriction can be achieved through intermittent fasting. And we will discuss intermittent fasting in details, we'll discuss the different forms, and we'll discuss the different benefits associated with fasting. Many people ask, what's the best diet to lose weight? Is it low-fat diet? Is it low-carb diet? Is it keto diet? So what we know so far, the best diet to lose weight is the diet that you can adhere to. It's the diet that you can calorie restrict on. There is no evidence that one diet is superior than the other for weight loss purposes. There has been a recent interest on the impact of processed food versus ultra-processed food on weight, and I'm going to touch on this later during the presentation. How long is the eating period? Based on smartphone data that we have, we see that on average, people eat for 15 hours per day. So not only we eat too much, we eat for long hours. Okay. Is eating throughout the day the real problem? We have some data that suggests that people who graze all the time, that people who eat for long hours, have higher risk of obesity. They also have higher risk of prediabetes and diabetes, and they have higher risk of breast cancer. For this reason, it's intuitive that fasting, where people decrease the hours of eating, may help in addressing health conditions. So let's define what fasting is. So fasting is alternating periods of eating and fasting, and there are several forms. I'm going to focus on 4 today. The first one I'm going to discuss is alternate day fasting. From the name, you can tell what it means. Alternate day fasting, you fast every other day. When you're fasting in this form, on your fast days, you consume 0 calories. You can drink water, you can drink black coffee, but you should be consuming 0 calories. Because it's difficult to adhere to, it's difficult for people to adhere to full day fast, there is the alternate day modified fasting, in which people fast every other day, but on their fast days, they do not consume more than 25% of their calorie needs. So they're usually limited to 1 meal per day. The other 2 forms of fasting that are more popular, and a lot of people are trying them in the community, are the 5+2 diet and the time-restricted feeding. 5+2 diet refers to fasting 2 days a week. They can be consecutive, or they can be on random days during the week. On your fast days, you eat less. You consume 25% of your calorie needs. And on your non-fast days, you consume ad libitum as much as you need. This is similar to fasting Mondays and Thursdays in Islam, just to get it in context. The last form that I want to discuss today is time-restricted feeding. Time-restricted feeding is different. With this approach, people eat their meals and snacks within a particular window, and they fast for a certain window. So most people eat between 6 to 10 hours, but they do not exceed 12 hours of eating. Okay, so what happens when you fast? So initially, like after you eat a meal, your body uses the sugar and blood as a source of energy. When you're depleting this sugar in your body, you start to break glycogen in your liver to make sugar. And this is called glycogenolysis. When this is depleted, you start to break down fat as a source of energy. And this is called fatty acid oxidation. This switch from glucose, from sugar as a source of energy, to fat as the source of energy is called the metabolic switch. And a lot of the scientists believe that this is the reason we get most of the benefits from fasting. It's the metabolic switch. It's switching your energy source from glucose to fatty acid oxidation. Let's go over time-restricted feeding in a little bit more details. So as I mentioned earlier, time-restricted feeding, you have windows of fasting and windows of eating. Your windows of eating can be done early in the day, for example, from 9 a.m. until 5 p.m. This is early time-restricted feeding. Or it can be midday or late day. Ramadan is a form of late day time-restricted feeding because we're fasting during the day and our eating period is late in the day. For example, here in Qatar, it's between 6 p.m. and 4 a.m. So our eating period is for 10 hours and our fasting period is for 14 hours. So what happens with that? So when you do time-restricted feeding and you decrease your eating window, a lot of people experience decrease in their intake, decrease in their food intake. And when you have a decrease in your food intake, you have a decrease in your weight, you have a decrease in your fat tissue. A lot of the studies showed that people who fast have improved glucose control if they have diabetes or pre-diabetes. They also have improvement in insulin resistance. Some studies show that people who do time-restricted feeding have improvement in their cholesterol parameters, have improvement in their blood pressure. What's really interesting is that people who fast have lower levels of oxidative stress markers. They have lower levels of inflammation. They have better quality of life based on questionnaires. A lot of them report better mood when they're fasting. So as you can see, there are a lot of health benefits associated with time-restricted feeding. Let's talk a little bit about Ramadan fasting because it's a form of time-restricted feeding. The main difference is that our eating period is late in the day. We fast from sunrise to sunset, and then we eat between 6 p.m. to 4 p.m. There are several studies done on Ramadan fasting. It's probably the most studied forms of fasting. The issue with a lot of the studies is that they're different. They're done in different settings because people do different things in Ramadan. Some people eat moderately, some people exercise, some people overeat. So the results are not consistent. But there are several studies that show fasting during Ramadan improve blood pressure, improve sugar control, improve cholesterol, and help with weight loss. Let's now move on to talk about the 5+2 diet, which is similar to fasting Mondays and Thursdays. In the 5+2 diet, you fast 2 days a week. They can be back-to-back, or they can be on 2 random days. On your fast days, let's say Mondays and Thursdays, you consume 25% of your calorie need. And on your non-fast days, you eat ad libitum. Here, this graph compares people who do 5+2 dieting compared to our conventional dieting. Here, what we see that people who did 5+2 dieting and they calorie restricted 2 days a week had more weight loss in the first 2 weeks compared to conventional diet, but the weight loss was similar at the end of 50 weeks, at the end of the year. So in the short term, you may lose more weight with 5+2 diet, as long as you're calorie restricting compared with conventional dieting. But in the long term, it seems like both of them are similar in efficacy. So what's really important is to know which lifestyle works better with you. Is it this form of intermittent fasting that you can adhere to based on your lifestyle, or is it conventional dieting, the one that works best with your diet? Okay. With this particular study, there was no improvement in blood pressure, sugar, cholesterol, but that does not mean that it does not help. It all depends on the type of people they did the study on. They were healthier people, they did not have other comorbidities, so it's intuitive that they did not find improvement because not a lot of them had issues to begin with. Adherence is a big issue. So whenever I'm talking to someone about lifestyle intervention, my main goal is to be individualized, to individualize the plan based on what they can do. There is no one intervention that works for everyone. So it's really important to discuss different options and see what works best with your patients. Some people are able to adhere better to intermittent fasting. Others can adhere to regular conventional dieting better. Let's now talk about ways to optimize your health when you're fasting. There are 2 areas that I want to focus on: to control what you eat and control how much you eat. What you eat really matters. Kevin Hall is a researcher at the National Institute of Health in the US. He did a recent study. He admitted people to the hospital, healthy people to the hospital. He gave half of them highly processed food, which consisted of nuggets, canned pasta, canned ravioli, frozen pancakes, frozen fries. So it was highly processed. And he gave another group minimally processed food consisting of salad, lean meat, full grain carbs. Both meals were equal in calories. They were given 3 meals throughout the day. They were equal in calories. One group received the ultra processed, the other group received the minimally processed food. They were allowed to snack in between meals as much as they needed to. And what they observed is that the people who consumed highly processed food ended up consuming more snacks, they ate more snacks, they consumed more calories, they gained more weight over the 4 weeks period compared to people who ate minimally processed food. So the type of food that we eat influences how much we eat, how much calories we take in and how much weight we gain. The second point that I want to make is about portion control, controlling how much you eat. Everyone burns certain calories per day, okay? And this is called the energy expenditure. And your energy expenditure is determined based on your basal metabolism, your thermogenesis, your physical activity, okay? If what you're taking equals how much you're burning, then you will be in energy balance. Your weight will be stable. But once your intake is lower than your energy expenditure, you will be losing weight. So calorie restriction is very important for that reason. There are ways to determine how much the energy expenditure is. What's the basal metabolic rate? There are equations such as the Mifflin equation. In clinic, we have the body composition machine, which uses the lean body mass to calculate the basal metabolic rate, which is more accurate than the equation. So I can tell when I'm seeing a patient in clinic, I can tell him or her that her body has a basal metabolic rate of, for example, 1700 kilocalorie per day. To lose weight, we need to consume less and we need to adhere to a lower calorie diet to be able to lose weight. This is an important question that frequently comes up: how to maintain muscle mass when fasting. Something that a lot of people don't know is that when they lose weight, regardless from the methodology, whether it's conventional dieting, whether it's intermittent fasting, whether it's surgery, around 20 to 30% of what you lose is muscle. So are there ways to preserve some of the weight when you're losing weight? There are some studies that looked at this. Some people advocate for adequate protein intake, which is very important during weight loss to maintain your protein store, your muscle store. The other thing that's very important, if possible, is to be involved in some resistance exercise, some weight training exercise. There are studies on this, and the studies show that people who are involved in resistance training during their dieting pattern lose less muscle mass than people who do not exercise. But for weight loss, just to make it clear that I delivered the point correctly. The most important thing for weight loss is calorie restriction. Exercise plays a role in preserving the muscle and in weight maintenance after weight loss. To conclude, we currently have evidence that fasting may improve weight loss and improve cardiometabolic health. Most of the benefits derive from energy restriction. So energy restriction is key. I know a lot of us don't adhere during Ramadan. Ramadan is a great opportunity to calorie restrict because our eating hours are limited to 10 hours. If we pay attention and monitor what we're eating and how much we're eating, we have the opportunity to optimize our health significantly. Not all forms of intermittent fasting may be feasible. And this is all about like feasibility, adherence. What we care about is sustainability. So when you're looking at the different forms, think about your lifestyle, think about what works best with your schedule, and apply the one that you can adhere to. Thank you. And I'm happy to take any questions that you may have.
Okay, great. Thank you so much, Dr. Chukir, for that wonderful presentation. I mean, it's such a broad topic, so I know this is more like a primer that you've given to the audience. So we do have some questions that have come in, and I'm going to start off with these. So just one comment, though, I really liked it, you know, when you started with obesity, and then when you said, okay, how can we address it? The first thing said, you know, lifestyle, behavior change, you know. So I'm really, really happy about that. I think that's a shift that we need to make, you know, in our thinking and healthcare providers, that the first thing should be our lifestyle and behaviors. And again, calorie restriction, diet, and physical activity, and all of those good things that we need will really, really help us, you know, for beneficial health outcomes. So thank you so much for that. So just coming back to the questions regarding your talk. So we have one question asking, should we avoid cereal, which has gluten when we break the fast? I mean, people have different perceptions that might be hard on the intestines. So what are your thoughts about that?
Sure. So I'll address it in two different ways. So there are different forms of cereals. There are cereals that are highly processed, and there are cereals that are not highly processed. They're minimally processed, and they have full grains. So when you're buying your cereals, I would pay attention to this. Make sure that you're picking the ones that have full grains. They're not fully processed. Yeah. So this is one thing. The other thing, how to break your fast. What kind of food you should consume. This makes me think about recent studies on food order. So they look at so they give people meals. They ask some people to start eating the meal the way they want, start with like carbs, vegetable, protein, all at the same time. And then they ask the other group to start with eating the protein and salad, and then end with the carbohydrate. And they found that people who start with protein and salad and end with carbohydrate have lower ghrelin level, which is the hunger hormone. So people are not as hungry if they eat with this sequence, and they have better sugar control. They don't have the same spike in sugar. So definitely, if you have issues with sugar, if your goal is to lose weight, then my recommendation is to try to keep the carbs toward the end. They didn't study this in people who had long fasts, so it's hard for me to tell. I know a lot of people break their fast with some dates. So it's our tradition, we all do it. It's hard for me to extrapolate this study to intermittent fasting because it was not done in this settings. But when you're beginning to eat your full meal, if your goal is to lose weight, if your goal is to control your sugar, this food order help with this.
Okay, great. So I think just, since you spoke about what the order of the food, so there was one question, about that should we break the fast with protein so we can take advantage of the growth hormone increase during the fast? Would that be a correct way of doing it?
Yeah. So we know what happens to hormones when you change the food order, but we really don't know what's the response after a prolonged period of fast. So it's hard for me to tell based on evidence because the evidence does not exist.
Okay, great. So let me ask you this question, Dr. Chukir. Is there an ideal time that we should be doing our weight? I know people do, they measure their weight at different times of the day. Is there really an ideal time, when we should be actually weighing ourselves?
Exactly. So a lot of people will experience some variation depending on when they check their weight. I tell my patients to check their weight in the morning on an empty stomach after they go to the bathroom, so that they can decrease the confounders that can affect the fluctuation. So this is what I recommend. And a lot of people recommend this way as well.
Yes, I would agree also. So just a similar question to the weight and the scale. So basically asking, the scales that people use at home, some of them provide a basic metabolic rate. Is that really reliable?
Yeah, so it depends on how they do it. Some of them, they ask you to enter your age, your gender, your height, and then based on their weight, they use one of the equations like the Mifflin equation to estimate what your basal metabolic rate. Okay? It's not the most accurate way, but there is some accuracy to it. Others have ways to measure the lean muscle mass, and from the lean muscle mass, it can calculate it. So these are estimates, and they correlate well with the real basal metabolic rate. Of course, there'll be some variations. In research settings, we do different ways to measure the basal metabolic rate, but it's not doable in real life settings because it's expensive, it takes time. But the non-invasive measures that we do at home, they can correlate, but you may see some variation.
Great. Thank you for that answer, Dr. Chukir. So another question, of course, people are thanking you for the wonderful presentation. So this participant is asking about, are there any specific type of patients in whom you would recommend fasting? Is there, something that you see in your practice? is there any specific kind of patient that you would recommend or maybe not recommend even fasting for?
Yeah, so of course, like we need to look at the comorbidities, what medications they are on. Some patients are on medications that prevent them from fasting. For example, patients with diabetes who are on insulin or some oral medications that lower the sugar, they should definitely not fast without consulting with their doctors, because adjustments of their medications should be done. Okay. Yeah. So fasting can be beneficial to a lot of people, just like going through the contraindication. And the main contraindication is risk of low blood sugar. If someone is desiring like weight loss, if someone's desiring optimal glucose control, I can discuss it with them and discuss ways to optimize their fast period. So it's a combination of fasting and lifestyle modification, as you highlighted earlier. Fasting without healthier lifestyle probably does not help as much as fasting with healthier lifestyle.
Yeah, so fast and then eat all the junk food, all the processed food may not be as beneficial. So yeah, no, I
Eat
totally
continuously from 6 p.m. until 4 a.m.
Yes. So there's another question about, asking if intermittent fasting increases the incidence of gallstones. Are you aware of any of that, or is there any study that, any research you may have read about?
Yeah, I'm not aware of this, no.
I am not either. So, okay, so that's great. So another question asking about, autophagy that happens during fasting, and what are the benefits, related to autophagy, and maybe you can just embellish on those, please.
Yeah, I didn't focus on this, but it's definitely a very interesting benefit from fasting. And so autophagy refers to the way the body can get rid of toxins, bacteria, dead cells. It's a good way. So people who believe that fasting helps against cancer, they believe that one of the mechanisms is enhancement in autophagy. And there's a lot of research on this. This is a great question. And fasting definitely seems to help with this.
Okay, great. So here is a question, asking about how do you gain weight in Ramadan, or how do you increase muscle mass? Or can you talk a little bit about that?
Yeah. So there are two different things. So weight loss is different from building a muscle mass. If you're asking me how to lose weight during Ramadan, it's a great opportunity because calorie restriction during Ramadan can be easier because the eating window is for 10 hours. But if during the 10 hours, we end up consuming more calories than we used to before Ramadan, then it's intuitive that our weight will go up. So to lose weight, calorie restriction is key. To preserve your muscle mass as you're losing weight, adding resistance exercise can help you do this.
Right.
If your goal is to bulk, to build muscles, then it's the opposite approach. So with bulking, with building muscle mass, we ask people to increase their calorie intake. Okay, so usually, like when I see people, our first phase is a phase of weight loss. After we reach the desired weight loss, we work on building muscles.
Okay, great. Thank you for that. So another question about what is a good time, to like eat nuts like almonds, walnuts, and also how much should the portion size be? If you are obese or overweight, how much should the portion size be for the nuts?
Sure, perfect. I'll answer one question. It just came to my mind. It's an important concept to keep in mind. The satiety hormones, the hormone that will make you feel full, will take time to be secreted. It will take at least like 30 minutes for the body to secrete them. So if you break your fast and you eat your full meal within 30 minutes, you stop because your stomach is full, not because your brain knows that you're full. So if your goal is to lose weight, a smart strategy is to break your fast with a few dates, water, rehydrate yourself, take a break, and then come back to finish your meal. So that you have time for your hormones to reach your brain and really tell you how full you are. Nuts are healthy. They have a lot of omega-3, a lot of omega-6, but they're high in calories because they have a lot of fat. Okay. I would say, like, depending on what your goal is. If you're healthy and your goal is to maintain weight, I would say you can consume like a handful of nuts. But if your goal is to lose weight, my goal is calorie restrictions through everything. With nuts, make sure that you're eating like healthy nuts, not the ones that are roasted with like bad oil or like too salty. So a lot of people come and tell me, oh, we eat a lot. Exactly. Salted caramel, chocolate covered, exactly. So nuts are healthy, but they're healthy when they're not combined with unhealthy, highly processed material.
Right, great. Thank you for that great advice. So Dr. Chukir, a very, very important question. So if you're eating healthy, and doing maybe the recommended physical activity, how can you get your metabolism to shift? There are so many of us, again, who feel, just getting those last 10 pounds, or maybe the 3 or 4, it's very, very difficult to get those off us. How can we get that metabolism to shift in our favor?
Yeah. So if are you referring to the weight plateau when people are losing weight and then they reach a plateau and it's hard to break it? Yeah. Or
no, not referring to that. I would just think of, if you're normal, healthy individuals, but you have a little bit of weight, which you've had maybe for many years. Yeah. And but you follow a healthy diet, you're sort of doing the recommended physical activity, and maybe even just eating enough calories, to sustain you. But again, you try everything, you're putting in extra exercise and things like that, but that last, maybe 10 pounds or the 5 kg doesn't shift down. Yeah. So we're really just talking about the goal is not really about, that you are trying that plateau, but you are at a plateau for many years. Think of it that way.
This is the most common reason why people come to see me in clinic. They've tried dieting for several times. They exercise and they've reached a point where either they're not losing enough, they're losing slowly, or they're not losing at all. So if we reach to a point where lifestyle modifications alone, after we talk about dietary restrictions, we try intermittent fasting, we try food order, we look in details about the diet, the macro composition. If we try all of these things and patients are not succeeding, then we talk about advanced therapies, which include medications that can help with that, procedures that can help with that as well.
Okay, thank you. So can you talk a little bit about, of course, in Ramadan fasting, we don't take fluids, we don't take any kind of food, but a lot of people, when they are doing intermittent fasting, they do take fluids. So do you think there is one fasting which is better than the other? And then if you're allowed to take fluid, what are the kind of fluids that we should be taking, during intermittent fasting?
Yeah. Interesting question. I always think about it. I think this is one of the big differences between our religious fast and the Western form of fasting. When you're doing intermittent fasting, you're allowed to drink water, you're allowed to drink tea, and most people allow you to drink coffee without milk, without sugar, as long as it's black coffee. It's hard for me to tell if they're different. There are studies that show benefit with both of them. The main challenge with Ramadan fasting is that what we know is very variable because people do variable things during Ramadan. But as far as I know, like both of them have similar benefits on weight, similar benefits on lipids, blood pressure, and sugar and insulin resistance.
Okay, thank you. So just a question about, the 5-2 kind of fasting where you're, eating regular 5 days fasting in 2 days. So do you like limit, the kind and the sources of the calories that you intake during the 2 days of the fast? Or can you talk a little bit about what we should be focusing on the 2 days when we're fasting in the 5-2 kind of intermittent fasting?
Exactly. So 5+2, on the 2 days that you're fasting, you're doing calorie restrictions on these 2 days. You're eating 25% of your calorie needs, typically like 1 meal per day on your fast days. And then the 5 days are ad libitum. Yeah. Based on the studies, it seems like these people lose as much weight as people who are doing conventional dieting.
Okay.
So it's very important to keep to pay attention to what the control group. So if you're controlling it to conventional dieting, you will lose the same weight. But if you're comparing it to no dieting at all, then you will lose more weight with the 5+2 diet because you're calorie restricting on 2 days per week.
Right. Great. Okay, so I think we're done with most of the questions, but there is one question that I would like to ask that, of course, as we age, and especially for women, when they're approaching menopause or during menopause, they tend to put on, they of course, weight gain increases, and especially, belly fat around the belly area increases. So what would your suggestions or strategies be for, women in this age group to try and help address that? I mean, is there anything particular that you would suggest? I mean, I know it's not specifically related to, fasting, but is there something that you can, tell us, which would help?
Yeah, it's something that we see all the time. It's real. We know it happens with the hormone changes. Maybe there are not a lot of studies on it, but just like from anecdotes from real life, it does happen. So usually when I see this, it depends on how severe the changes are. So I try to address them with lifestyle modifications, reinforce like healthier lifestyle. But if it get to a point where, let's say there's significant weight gain, and it's not responding to lifestyle modifications, there are a lot of times that I considered giving medications to help with that as well. Hormones, to give like hormones back, it depends on the symptoms. So I give hormones if they're needed. So if someone is really bothered by, let's say, flashbacks and so on, these are the reasons to give hormones. But for fat redistribution, fat accumulation, I'd rather address it with a safer ways, medications to lose weight, than to give hormones that may have other side effects. So it's all like case by case. I'm not saying I don't give hormones. No, I do give hormones, but I try to pick the safer option.
Sure, absolutely. Okay, so I think we're done with the questions. So thank you so much for your time and, for making time out from your busy schedule. So I think it's been a wonderful, informative session. Usually at the end of the session, I do ask our speakers, to what are like the key tips you would like our participants to take away from your talk today, the talk that you gave them? What are some key things that they can take away, which, would be helpful for them in their daily lives?
Thank you. Thank you for the invitation. Thank you for the great questions. They were all important and made the session very interactive. So the first point I want to make is pay attention to what you eat. Even if your goal is not to lose weight, make sure you're eating the right thing. If it's not for yourself, it's for your family, for your kids, for the next generation. So make sure you're picking the right options, the minimally processed food, the healthier options. I'm not saying you cannot have treats. No, you can have treats, but not multiple times a day.
On a daily basis.
Exactly. So this is very important, especially now with like talabat and how easy it is to order things. A lot of people are ordering ultra processed food, and this is just like that. Okay. So we talk about what you eat, even like lifestyle, like exercise, adding physical activity, even if you're not planning to lose weight, is good for your health. It's good at different levels, both for your mood, for your performance. So exercise is definitely a key thing. And then the last thing is calorie restriction. We eat too much and we eat for long hours.
Right.
We may wake up at 6. Some of us would have like tea with biscuits. This counts. So you actually start eating at 6. And some of us sleep at midnight and they would eat right before they go to sleep. So it's very long hours of eating. So pay attention to how long you're eating and how much you're eating. Yeah, these are the 3 points that I wanted to make.
Great. I think those are excellent points. As you may know, that we also are really propagating lifestyle medicine, at the Institute for Population Health. So that also, resonates very well with what you've said, eat healthy, move more, sleep well, manage
Yeah.
your stress, maintain good, positive social connections and, avoid alcohol and other drugs and tobacco. So those are the key messages also to all of our participants. Thank you again so much, Dr. Chukir, for this wonderful talk. Really, really great talk. Thank you for your time.
Thank you. Thank you for the invitation. It was a pleasure.
Great. So we would like to thank all our participants, who've joined us from different parts of the world. We are really, really happy that you could join us today. And we hope that you can take away some key tips, which you can engage with, you can practice, and to ensure, that we are living healthy lives. So as Dr. Chukir said, and I will just reiterate this, a life is a gift to us. So we should really be mindful of what we are putting into our bodies because we want to keep our bodies healthy for as long as we can. So thank you, everybody. We look forward to having you join us in next month's session. So inshallah, Eid Mubarak to all of you. Of course, I won't see you before Eid again. So Eid Mubarak to all of those who will be celebrating Eid in advance. And inshallah, we'll see you at the May session in which we'll be talking about headaches. Again, a very common problem, but something we hope that we can try and address and see how we can get rid of.